today we're going to learn about restraints. I want you to know that restraints are illegal in the nursing home unless a doctor orders them. They can only be used for the protection of the resident, them hurting themselves or them hurting someone else. Again, restraints cannot be applied unless a doctor specifically orders them, and there's usually only two kinds of restraints that we can use. One is called waist restraint and one is called a vest restraint. Just for your knowledge base, I do want you to know that side rails are considered a restraint. If we put someone in bed and we put all four side rails up without a doctor's order or on the care plan, that can be considered a restraint because what we're doing is making that person stay in that bed. In the olden days, they used to put the side rails up and put a waist restraint on them, and these little people would try to climb over the side rails and sometimes strangulate their stomach area or what have you. So now, we have to have a doctor's order. There are a couple rules you have to remember with restraints. One is you must visually check on that resident that has a restraint on every 15 minutes. Every 15 minutes you have to walk by that door. You have to know that they are safe. And the other rule is every 2 hours you must take that restraint off, reposition the resident, and then reapply the restraint. You will have a log that you will keep track of this on, and you will document that you have been doing those two rules in a nursing home. We do not want anyone to get hurt with a restraint. And again, they're used very, 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 very seldom in a nursing home. We're seeing them more in the hospitals at this time. So I'd like to demonstrate a couple of them for you. The first one is a wrist restraint. This is going to go on the patient or the client, the resident's wrist, and then it's going to be down on a sturdy surface. We're going to use this arm of the chair right now. Hi, Melissa. I'm Amy.
Hello.
How are you?
Good.
Good. These are wrist restraints. Now, we're just putting them on for pretend, but I do want to demonstrate how these work, okay?
Alrighty.
Okay. So, the very first thing is you're going to want to hold them out. The wrist goes through here, okay? You're going to want to take, and then move your arm back just a little bit, see if you can get it around here. We're going to put the Velcro on. Now, one of the reasons it has Velcro on it, every restraint has to be released with one pull. It cannot have a knot in it. It can't have apparatus where it's locked or a fastener of any kind. It has to be able to be released with one pull. Why do you think that's important? Well, if there was a fire or we needed to get Melissa out fast, we could do that with one pull. So Melissa, I'm just going to pretend, put that one on. I'm going to come around here. I'm going to apply this one. It goes through the ring. And then you're just making sure that the stickiness of the Velcro is sticking. Okay, Melissa, go ahead and try to lift your arms up. You're pretty restrained, aren't you?
Whoops.
Have
There
you
we go.
seen one of these recently?
No.
I have not seen a wrist restraint in a long time. Again, it's one pull,
More in
and
the
it's
hospital.
more at the hospital, and it releases real fast. There we go. Wrist restraints. The next one I'd like to demonstrate is a waist restraint. This will go on in the front, and this is the way it's usually put on. We cross the straps in the back, and then we bring them through the loops right here. Okay? This is where we hold somebody in, and then we tie these. I'll demonstrate this, but I want to make sure that you know how this waist restraint is being applied. Okay? It's so important if you're using one of these apparatuses that you do it the correct way. So Melissa, I'm going to go ahead and put this on your stomach. I'm going to
Okay.
ask you to lean forward. I'm just crossing it in the back, and I'm bringing it around to the side. I have to put it through the loop here. Get it comfortable. I have to put it through the loop here. And then Melissa, I'm gonna turn your wheelchair around so I can demonstrate. Thank you. How it comes right through the back here. Doesn't get tied to anything, okay? Not yet. What we have to do is, we have to get down here. Melissa, that's not too tight, is it? Go ahead and cross it right here. You bring it on the outside of the supports of the wheelchair. You bring it up here, and you have to tie a slip knot. You're gonna have to practice with this a little bit, but a slip knot is something that can be pulled with one finger. Okay, and that's how the restraint needs to go. I want Melissa to turn back around so you can see how it fits right on her waist here. Okay, Melissa, can you lean forward a little bit? Yep. And that's what it's to do. It's safe, it's comfortable, but it keeps Melissa in her chair should she need to be restrained for her self-protection. That's why we put on restraints. Again, go ahead and unlock it, and I want to show them how to take it off real easy. So let's say we had to remove Melissa in a hurry. We just bend over, we pull this, and it comes right off with one pull. That's what's important with the restraint, okay? I'm going to go ahead and take this off. Remember, the rules are when someone has a restraint on, you have to visually see them. Every 15 minutes, check on them, and then you need to release them and reposition them. So one of the things we've taught is that we could lock this wheelchair, yep. Just have them stand up. Melissa, can you stand up? Mm-hmm. Can you stretch a little bit? Mm-hmm. Okay. And can you turn around? Yep. And go ahead and sit back down again. That's exactly what we mean. And then we would put the restraint back on and reposition them. Okay? The last one I want to show you is the vest restraint. A little bit more technical, but it's going to go on and cross again. So Melissa, we're going to ask you to put your arm through there. Okay? Put it around. It's got big long strings on it. Good job. Pull it down in the back. Yep. The long strings, they go through this one. Yep. And right over the top of this one. Again, I'm going to turn this chair around so you can see how it comes through the back here. It's not too tight, is it, Melissa? No. Okay. I'm going to cross it on the support of the wheelchair, bring it back up again, flip it over, making a slip knot. These strings are a little bit longer, so it's going to be easier to see. Pulling it up. There we go. Okay, that's a slip knot. Go ahead and lean forward, Melissa. Would that keep you in your chair? Mm-hmm. Sure. Okay, again, you pull both of these. One pull, it has to release so we could get her up if there was a crisis or a problem. Go ahead and unlock that one. So that's a vest restraint. The other, oops, I need you to go forward. Oops, there we go. A vest restraint, waist restraint, and wrist restraints. Check every 15 minutes and release every 2 hours.